Is there anything worse than having an upset stomach or other stomach symptoms? These type of problems are not only irritating, but they can also be embarrassing and affect your quality of life. As stomach symptoms are very common with adrenal fatigue, that's what we're going to talk about today on the Dr. Lamb Show. I'm Dr. Carrie Lamb, family medicine physician, board certified also in anti-aging and regenerative medicine.
Hi, and I'm Dr. Jeremy Lamb, a board certified internal medicine physician, also in anti-aging medicine as well. And so if you've been struggling with painful, uncomfortable, or embarrassing stomach symptoms, then you're going to find something in today's podcast that will help. And we're going to first start with constipation, what it, and how to correct it. So Dr. Kiri, what really goes on with constipation?
Most commonly, when you have adrenal fatigue, um, your energy drops, not only outside your body, inside your body. And so, in an effort to conserve energy, a lot of your systems actually start to slow down, notwithstanding your digestive tract, because that will also want to slow down. When your metabolism is slow, your digestion also slows down. So, when your digestive tract slows down, things don't move as quickly through your bowels. And so you can get slow bowel movements or constipation. And sometimes the constipation is not, it doesn't have to be very extreme. It can just be maybe not going every other day or not going every day, or it's just harder than normal. And this is a normal physiologic construct to when you have adrenal fatigue in order to conserve energy.
Right. So what you're actually trying to say is this is kind of your body's way of trying to actually conserve energy, and constipation is its way of trying to fight off that stress, right? To be able to only have your most vital organs have the most effect, basically. So it's going to shut down your digestive system. That's what you're trying to get at.
Yeah, I guess we should have put a disclaimer in the front. If you're eating, maybe not the best time to listen to this, right? Because we are going to get down into the nitty gritty of the stool, and sometimes these are things we do need to talk about. You want to make sure that you are having daily stools, or else something is going on in your body, and you have to think what could be actually slowing your body down. So, Dr. Jeremy, what are some symptoms you can get other than being when you are constipated? What do people feel when they are constipated?
So, one of the other symptoms is getting a lot of bloating that also comes with constipation. And you can get a lot of gas as well because when your bowels slow down, then your food is getting digested slower, it's passing through your GI system slower. And so you have that gas buildup, and all know how uncomfortable that can be for us.
Right. And sometimes people have pain when they're trying to push the stools out. And sometimes the gas can be so bad it can cause abdominal pain, especially also in children. They may not be able to know what is causing their pain, but it could just be constipation. And if you strain hard enough, maybe hemorrhoids can show up when you do finally get the stools out. And so that's very common when you get bloating. You have to see, hey, is constipation one of the biggest things that are going on? So what can you do when you have constipation?
Well, I think the first thing, again, like you had said, is to make sure that you know that this is not normal. A lot of us deal with constipation and you kind of just sit on the toilet trying to go and trying to push. And then there are side effects of that, like Dr. Carey had said, which is hemorrhoids is one of them. So really, you want to make sure that your bowels are moving every day. And also that's because that's your way of getting rid of, the toxins in your body is to have regular bowel movements. So making sure you have those. And one of my favorites is to always recommend magnesium. And so magnesium is really nature's natural muscle relaxant, and it also helps relax your bowels. And then also at the same time, it relaxes your mind and then relaxes your muscles and relaxes your body overall. So magnesium is a really great supplement to really help with constipation.
One way I remember that is the chemical on the periodic table. It says Mg, and I think makes you go. Magnesium makes you go. And really, there's no overdosing on magnesium. I tell my patients all the time, it's very hard to overdose on magnesium. The only side effect you might get is, feeling a little more calm and sedated, but ultimately just diarrhea, which is one of the symptoms we might want, especially if you have constipation. It causes loose stools. So the way you would dose the magnesium is you just keep increasing until you get the to bowel tolerance, we call it, which is the loose stools, and then you just back off by one, right?
Mm.
And so it's a great way
Yeah,
to
and do
relax your
you?
bowels.
Hmm. And I know
Another
we always get this question a lot about what type of magnesium. Do you have any preference on what magnesium you recommend?
Right. I would say for if you're using it specifically for the bowels, probably mag citrate, as it would be able to help loosen your bowels. Other types of magnesium that might be easier to absorb would be magnesium glycinate or mag chelate. If you're using magnesium for blood pressure to relax your blood vessels, mag taurate. So there's a lot of different ones, but I would not recommend magnesium oxide, which you can see a lot. Very frequently in the store, but that's not something that I would recommend because the absorption is not that great. So it does depend on what you're using the magnesium for. But if you're thinking for stools, then yeah, mag citrate would probably be really good for helping to loosen your bowels. Other than magnesium, is there some other tips or supplements that you would recommend to help people get their bowels moving?
Well, our next supplement that would be good is vitamin C. And it's really great not only for your bowels, but also for the adrenals. And so it's one of the critical vitamins to really help your adrenals heal and repair. Now, actually, in a small number amount of people, it can actually cause constipation, but these are normally happening in adrenal fatigue sufferers who have paradoxical reactions, where such as they take magnesium and they get excited instead of actually feeling relaxed, or they take vitamin C and then they actually get more tired. So those are the cases where you need to be careful in taking vitamin C. But most oftentimes, vitamin C at high doses can sometimes help with constipation as well, because that's also one of the things where if your body has too much vitamin C, then you start to have diarrhea, and then that's also when we know that you have to back off from it.
Yeah, and the same question with the vitamin C, Dr. Jeremy, any specific type of vitamin C or delivery systems that can be causing this?
Well, liposomal versions we always prefer. And so liposomal version of vitamin C is actually vitamin C, which is water soluble. And so then it's encapsulated in a phospholipid bilayer, which is fat. And then so it gets slowly absorbed more through the small intestine, as well as it's able to penetrate some of your cells more because of your cells are also around in fat. And so liposomal versions are very good. Other types is also just regular ascorbic acid. That's more for the constipation aspect. And then if you're wondering more about, how to help in adrenal fatigue, that's a whole nother podcast that we can talk about with just the different type of vitamin C's that we use, the different routes, the different
Mhm.
formulations as well that we use for adrenal fatigue sufferers.
Right, right. What's also very important in constipation is to think about your fiber intake. A lot of times, people on a sad American diet might not be getting enough fiber in their diet. And so, either increasing their amount of vegetables or kind of whole grains or a whole bran or fiber is very important in your diet to kind of bulk up the stool in order for you to pass it smoothly. But the fiber, it needs hydration, right? So most of the times, people who are constipated are not drinking enough water. They're dehydrated. And so, because they're not drinking enough water, there's not enough water to moisten the stool up, and it causes it to be hard. And so, drinking enough water is very, very also important to help moisten up your stools and be able to get it moving. So what's a good fiber, type of supplement that could be used, Dr. Jeremy?
Psyllium husk is very good because it helps pull the water into your bowels, and then so it helps keep that flow going, right? So we again need to stay hydrated, and then also supplements like psyllium husk can help pull more water in to really get those bowels going. Um, and like you said, staying hydrated is just very important. And actually, I catch myself doing this all the time where I already start to feel thirsty. And so when you already have that feeling, that means you're already dehydrated. So you should never really get to that feeling where you're feeling thirsty, then that you're already falling behind in how much water you should drink. So always stay ahead in drinking that amount of water that you should be.
Yeah, water is good. And some other fruits that I would recommend start with a P that can actually help you poop. I guess if this will help you remember, peaches, pears, prunes, and papayas. They're all very great for helping loosen your stools too. And so if you wanted to change more of your diet rather than go to supplements first, those are also very important. And the last thing for constipation is to make sure you are moving. If you're just sitting around all day, your bowels don't have an opportunity to actually have peristalsis, which is movement of the bowels. And so you want to be able to maybe do gentle walking, or if you are too weak to walk, you can do like abdominal massage, where you massage it in a clockwise fashion where you're just moving the stool along. So a movement is also very important to helping constipation.
That's right. And so, as you can tell, constipation can be very uncomfortable and more difficult to correct than you might think. So, try some of the ideas that we had just mentioned before. But if you're really suffering, then it might be time to get some help from an adrenal fatigue expert by talking to one of us. So you can give our office a call at 714-709-8000, and we can help you with your constipation.
Now that we've talked about constipation, we're going to move on to another very common symptom in people with adrenal fatigue, and that is bloating, or the feeling of feeling just really distended from a lot of gassiness. And there are multiple reasons why someone can feel a lot of bloating. Dr. Jeremy, what are some common ones that you've seen?
Well, some of them can be from, again, like if you have just undigested foods going through your bowels, then that could be one reason. The second could be from adrenal fatigue as well. If you're having slow bowels, then that's going to be backing up as well. Other times can be either if you have not enough stomach acid or too much stomach acid, sometimes that can cause bloating. And also, things like leaky gut or small intestinal bacterial overgrowth, all can be really reasons that can be cause for bloating in our patients here. And
Mhm.
so, Dr. Carey, I mean, there's such a wide differential, right, of what can cause a bloating, and we can
Mhm.
spend a lot of time in going into how we investigate it. Because first, I think is you kind of have to find the root cause of what's going on, which is not really about today's topic, but we want to just give our listeners some tips on what they can do to help with the bloating. So, what would you recommend, Dr. Carey, for that?
Yeah, so the first thing would be to say, hey, when do I get the bloating? And that can give you a little more insight into what the bloating is from. Some people have bloating around their cycle time, and that's maybe more of a hormonal issue, a PMS, premenstrual symptom of more bloating, or just feeling very swollen in their body. And that means you have to look more at the hormones. Some people, they get bloating right after they eat. If you eat a meal and then you get bloating right away, you have to think about your stomach acid content. Maybe you don't have enough stomach acid in order to help you digest your foods very well, and therefore you get bloating right away. Some other people, they get bloating a few hours after eating. And then because it takes time for your food to go through your small intestines, and you want to think about the small intestine bacterial overgrowth, SIBO, like you called it, right? And so finding the root cause is very important, and you kind of need a good experienced practitioner to kind of tease apart what it could be. So I do, yeah, suggest that you can call one of us to really find out what the root cause of the bloating is. Our office number is 714-709-8000 for a free initial phone call, just to talk about your the bloating or the constipation that you might be going through. And we can also put you on some challenges. But if you wanted to try something at home, if you think that it's due to the stomach acid, low stomach acid, try either taking some betaine hydrochloric acid, if under an experienced practitioner's care, or you can try some apple cider vinegar with your meals or right before your meals and see whether that does help you. If it's hormonal, get down to the hormonal root cause, like I said. And there are also additional testing you could do for SIBO if it were that, and your doctor would be able to order that for you.
Some other things that could also be helpful is, taking some digestive enzymes. Sometimes that might help with the bloating, and take it before each meal. But again, it depends on what the underlying root cause is, right? Because it could potentially make things worse as well. Sometimes, you might just not even have enough good bacteria. So sometimes probiotics help, but also depends if you might have SIBO, then it might make it worse. And then, like you said, yeah, like the betaine HCl is also very good. Some people also find that, cordyceps can also sometimes help with bloating as well. And then, we have a very good recipe, where you take some flaxseed and then you put it in some water and you heat it up, and then it becomes kind of slimy, and it kind of actually helps coat your stomach as well. And sometimes that helps with bloating as well. So, if you actually want this recipe, then you can actually call into our office and, make an appointment, and we can kind of discuss further into, what could be the underlying root cause of what your bloating is, and really target that root cause, and kind of just shooting kind of in the dark, but doing some targeted therapies that would help you get better, get on the right track, and kind of just solve your problems once and for all.
Yeah, that's really great. Getting to the root cause, like we keep saying, is just so important in what we do in integrative and functional medicine, because trying to put band-aid symptoms on, like if you go to a doctor and a conventional doctor, and you just told them, you had stomach pain, and they might just put you on an acid blocker, well, like omeprazole, pantoprazole. But long term, those are not good medications to do. They reduce your stomach acid. They reduce the ability for your food to be digested. Long-term mortality risk actually increases if you're on those acid blockers for more than 6
Affect
months.
your bones as well.
Yeah, osteoporosis, and it leaches, the minerals from your bones and those. So you're right. There's just so much that's not getting to the root cause. And so finding out why you have the constipation, the bloating, or other symptoms like nausea, vomiting, or diarrhea is very important to healing from the bottom up, rather than just fixing the band-aids.
So the next time you find yourself constipated or bloating, remember all the tips that we had mentioned, and you can try a few of them to see if they help. But ultimately, again, like we mentioned throughout this podcast, that getting down to the root cause and finding out what's causing those symptoms is very important, or else we'll just be putting band-aids on and things might snowball and get worse. So give our office a call at 714-709-8000, and we'll help you investigate and find out what the root cause is, so then you can get your health back on track.
So remember to call us if you have any questions. I invite you to subscribe to our podcast, The Dr. Lam Show, anywhere you are listening right now. Stay tuned for our next episode. Remember that we're here to empower you to take control of your health.